we have constituted ourselves, as it were, the guardians of their women's interests, and in many cases, the custodians of their honor. And I think that the history of psychiatry's treatment of women, particularly poor women, is an instructive example of this. Predictably then, by the mid-19th century, the majority of not only asylum patients, but all psychiatric patients in England were women. And the reason for this is a kind of patriarchal pathologization of female distress. So what do I mean by that? Well, the term pathologization just means to interpret something as a disease or disorder. Well, the term patriarchy gets thrown around a lot, and it's not often explained, so I'm going to give it a shot here. So the word itself comes from the Greek word patriarchus, meaning ruling father, and it is often used to refer to a system of governance that follows this kind of daddy knows best approach. So there is supposed to be this superficially benevolent but ultimately quite tyrannical male authority figure in whose gaze women are largely infantilized, if not directly excluded. It's a kind of patronizing but brutal authority. And if we take the two terms together, a patriarchal pathologization of female distress refers then to this tyrannical father figure who's looking at women's distress and making it out to be some kind of illness or disease. Now, historian Elaine Showalter has described how in the 19th century, almost all behavior in women, both in and outside of the asylum, that was seen as disruptive to the traditional sex-based roles of Victorian society, was pathologized in some way. Importantly, that this pathologization was expressed in biological and not really in environmental terms. So what I mean by that is, if something is expressed in environmental terms or given environmental causes, you could say X thing is happening because of these circumstances. If something is expressed in biological terms or given biological causes, you would say X is happening because of the biological factors that this person has. So it's the contrast between a nature and a nurture framing. Why is that important? Well, the majority of asylum patients in the mid-19th century were not just any women, but they were poor women. And in part, this was because certain supposed mental diseases were linked specifically to poor women, such as lactational insanity, which was thought to be a kind of anemia-induced madness brought on by prolonged periods of breastfeeding in malnourished poor mothers who could not otherwise afford to feed their children.